What causes hair thinning?
A common query in search is from people trying to understand the cause for their hair loss. Although most hair loss is caused by genetics and falls under the category of androgenetic alopecia, there are situations where other diagnoses need to be considered. I'll discuss my approach to helping my patients determine the cause or causes for their hair thinning and what we do for them. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I'm also the founder of TrichoStem Hair Regeneration, a non-surgical treatment system which I developed from observations made when we were using a material called extracellular matrix by a cell with PRP or platelet-rich plasma to enhance the healing of grafts after hair transplant surgery. Since 2011, we've been treating men and women from all over the world, improve their appearance, and deal with their hair loss with TrichoStem Hair Regeneration. As I mentioned earlier, about 95% of all hair loss cases in both men and women are caused by genetic pattern hair loss, also called androgenetic alopecia. Androgenetic alopecia is characterized by different rates of hair thinning, resulting in reduced scalp coverage. The thickness of the hair decreases in a process called miniaturization. Hair density also decreases, so fewer hairs are actively growing. Male pattern hair loss can appear to be diffuse as well as concentrated toward the frontal, temporal, and crown areas. Generally, male pattern hair loss is common and seen as normal. In contrast, a large number of women also experience androgenetic alopecia, with estimates of 30% of women under 50 and more than 50% of women over 50. Female pattern hair loss is mostly characterized by diffuse thinning. Some women also have temporal recession. We see a lot of women in their 20s and 30s who have biopsy-confirmed androgenetic alopecia. I usually try to determine if any hormonal factors may be contributing to their hair loss. For example, hair loss is often seen in women with a condition called polycystic ovarian syndrome, or PCOS. Typically, an endocrinologist or gynecologist manages the hormonal aspects of this condition. Women over 50 with hair thinning are also often postmenopausal. There is a well-established correlation between a decrease in estrogen and hair thinning. Hair loss management for men and women can be categorized as 1. Medical, 2. Surgical, 3. Regenerative. Under the medical category, medical management for both men and women can include the topical application of minoxidil. Minoxidil appears to prolong hair growth cycles to a limited degree and unfortunately is also often associated with scalp irritation. Men can also slow down their hair loss progression and get some regrowth with a drug called finasteride. For women, medical therapy can include drugs like spironolactone and oral contraceptives, and in some situations, estrogen supplementation. In the surgical category, in my experience as a hair transplant surgeon through most of my career prior to my developing TrichoStem Hair Regeneration, the best candidate for hair transplant is a man with no hair in the front or frontal balding. Transplanting hair in areas where hair is growing unfortunately often results in significant loss of native hairs. Since female pattern hair loss is characterized by diffuse thinning, hair transplant can cause more hair loss than hair gain, and this also applies to men. As I mentioned earlier, around 2011, we used a material called extracellular matrix by ACell and PRP in an effort to improve the survival of transplanted hair grafts and the healing of the donor area. A year later, the transplant results were better, and areas that were not transplanted had more hair and thicker hair. I pursued and developed a system to dose and deliver this treatment directly to the scalp so men and women with hair loss can improve their appearance without surgery. Each patient's treatment is customized to their specific hair loss category. A typical treatment plan involves 1 to 2 treatment sessions, 18 months apart, with results lasting from 3 to 5 years and even longer. Our treatment has been so successful that we built a freestanding center in Northern Virginia specifically for TrichoStem Hair Regeneration. Although there is no cure for hair loss, there are strategies to help maximize your scalp coverage. There are a lot of commercial interests promoting supplements, devices, and other ways to address hair loss. My patients come in having tried many of these with no success. Additionally, medical retailers are offering generic PRP treatments with limited success and little interest in the long-term management of their patients. In my office with TrichoStem Hair Regeneration, I provide our patients with a treatment plan so they understand clearly the benefits and the limitations of any hair loss treatment strategy so that they can make an informed decision. We see our patients every 3 to 6 months for 2 years and review their results during every visit. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.